Okay, we're all set. Okay, good afternoon, everybody. I want to thank you all for joining me today. With me today is our Commissioner of Health, Dr. Patricia Schnabel Ruppert, and our County Attorney, Thomas Humbach. I'm proud to have them with me today in a very, very important announcement. First off, let me state unequivocally that I do not agree with the judge's opinion. The fact that the measles crisis does not rise to the level of an emergency, that is just not accurate, in my view. We in Rockland are facing the longest current outbreak in the entire nation and the largest outbreak in New York State in 30 years. I would think from a common sense perspective that certainly qualifies. And given the fact that there have been emergency declarations for snowstorms, if this is not an emergency, what is? While we here in Rockland are trying to stay ahead of what's becoming a nationwide epidemic, which was not even known 10 days ago when we declared this emergency, we have to deal with the flawed logic that gets in the way of the public health. With 3 in 10, 72.9% of those from ages 1 to 18 in Rockland not vaccinated, it is an emergency. I asked the judge or any other rational person, how high must our case count be before you will consider an emergency? 85% of these cases have been our children. I refuse to sit idly by while those in Rockland are put at risk, as my highest responsibility is the well-being of the people here. It is completely within my powers, granted in the New York State Executive Law 24, to determine what is and what is not an emergency. We will be appealing the judge's decision and moving forward with other steps to ensure the public health of Rockland is strong, vital, and free of preventable diseases. To be clear and unambiguous, the Commissioner's orders issued in December of last year still stand. These orders require any school with less than a 95% vaccination rate to keep unvaccinated students home. Schools must continue to comply or they will face significant fines. The judge has said only that in respect to his ruling that only the petitioner's children are expressly permitted to return to their respective schools and to otherwise assemble in public places. This is also a matter of legal dispute. I mentioned this earlier when we first declared the declaration of emergency about the changing trajectory of what we saw coming. And I have grave concerns about that trajectory of our outbreak here in Rockland today. We declared the state of emergency in an effort to stem the tide of cases, and yet what we feared has come to pass. In just 10 days, we jumped from 151 cases to 168. As I referenced earlier, nationally, in just the first 3 months of this year, we exceeded the total number of measles cases for the entirety of 2018. Florida, Indiana, Massachusetts, and Nevada have reported their first cases of measles this year, all in the last few days, bringing the total number of states reporting cases to 19. According to the Center of Disease Control, the total number of measles cases nationwide this year, and I quote, is the second greatest number of cases reported in the United States since measles was declared eradicated in the year 2000. Yes, we're speaking of a disease that 19 years ago was eradicated. We cannot have policy that will allow that to change, and that is exactly what has been happening here in this country, and we have it here in Rockland County. In addition to appealing the judge's decision, we'll also move ahead with new strategies to protect everyone here in Rockland. We are not going to sit idly by and wait for a judicial decision to take action. This outbreak is an imminent threat to our public health. You have to not be paying attention to not understand that. And we will take every action within our power to combat it. And again, I'll reemphasize, doing nothing, in my view, is absolutely not an option. Our Department of Health is finalizing the criteria for new orders for our commission to keep people who may have been exposed to the measles in their homes and away from public places. This is a slight pivot from our state of emergency, but is a step we can take very quickly while we can wait on the legal appeal. Any violation of those orders will lead to significant fines. This is all in an effort to limit and prevent exposure to others, no more than that. As we recently saw in Nyack Hospital, 42 people were exposed to the measles. And personally, I have a serious issue with that. In that cadre of people, pregnant women, infants, people who have compromised autoimmune system, what of their rights? What of their rights? One person with measles can spread this exponentially to others, and as Dr. Ruppert has done throughout the outbreak, while we urge you to seek medical care, if you believe you have the measles, please call ahead. Just don't go to the doctor's office or hospital or medical facility. I emphasize this again. Please call ahead to limit possible exposure to others. We are redoubling all of our efforts at the Department of Health, and the New York State Department of Health has committed more staff and resources to these efforts. New York State DOH has been of great assistance since the outbreak began last October. We are happy to have their help, and I want to publicly thank them for their assistance in this crisis. This outbreak is causing ripples across our entire country. We are seeing an economic impact as people react with understandable concern and fear. I need tell no one here that the thought now on people's minds when they go out, has someone been here with measles? We have had situations where we have in shopping centers, other public places, cabs, stores, where we have discovered people who have had measles have been at. And I remind you, for up to 2 hours, a contagion can be alive and well and transferable to another unvaccinated person for 2 hours. And this is personal. People who can be compromised, infants, that's personal. I have a grandson who is an infant. Rockland is a very small geographical county, and that's why this outbreak affects all of us. We cannot put our heads in the sand in the face of reality, and hear me now, we will not. With that, I would like to introduce our Commissioner of Health, Dr. Patricia Ruppert, who will discuss some of the steps that we'll be taking in the next coming days. Dr. Ruppert.
Thank you. Good afternoon, everyone. So as County Exec Day has mentioned, we are in the process of developing criteria to identify individuals who will then be issued new County Health Department orders. These new orders are being developed to further prevent the spread of measles by requiring unvaccinated people who have been exposed to the measles to remain home and away from public places. We are working with our law department to ensure fairness but thoroughness in these orders, with the overarching goal, as always, of stopping the spread of this disease. Since December, the Health Department has required that schools provide a list of students each Friday who have been excluded, based on my order to keep unvaccinated students home from school if the school has less than a 95% vaccination rate. I still expect this list to be provided each week by all schools that are affected. We will continue to cite violations for those who are not in compliance, as the order allows. And if you recall, we did this back in December very successfully, and to date have 100% compliance with these requirements from the schools. As the seriousness of this measles outbreak grows, we have taken steps to augment our efforts with additional staff and resources from the New York State Department of Health, and they are on site at present at our health department today, as they have been this week. They have been with us for many weeks, but now they've increased the staff that they have sent, and boy, do we need them. I'll talk a little bit about the importance of vaccination, since truthfully, that's what this is all about. We need to prevent the disease. Then, of course, as people are diagnosed, we need to then have containment efforts, but more important right now is prevention. Disease prevention is paramount. The MMR vaccine actually works faster than the incubation period of the disease. And I've said this multiple times, and I just wanted to remind you again, the importance of someone coming to us either through reporting from a physician or the emergency room, wherever the patient is seen, is so vital, because if a patient is diagnosed with measles, we do a contact investigation right away, determine who is unexposed, who is not properly vaccinated, and we can offer the patient MMR vaccine or immunoglobulin. I'll explain the difference. MMR vaccine is the active virus that can be given to those people who have no issues getting it, which are most people. It is a safe vaccine. For those who are pregnant, little children below 6 months of age, or those with immune issues, we offer the immunoglobulin. That's passive immunity. The MMR vaccine we can give within 3 days of an exposure. So it is critical that these are reported to us, and we can give that to help ameliorate the disease itself. For those who need immunoglobulin, we have a little bit larger window. We have 6 days. But do you see the point? We need to have these cases reported to us promptly. And that's been an issue in this county. We have not always had that. Not to say that the physicians and other providers are not reporting them. It's just that people in the community of Rockland have not always reported them to their doctors, I guess knowing that they're going to report them to us. But again, the MMR is safe and it is effective. And for whoever else is out there thinking that there are issues with the MMR vaccine, that it causes the measles, it's untrue. For those who have said, well, they're shedding from the MMR and therefore people are getting the measles from that, or that can cause problems with those with immunocompromised states, we don't really see that. I read an article this morning that again talks about those who really have to be concerned about getting live vaccines. There are other vaccines that were mentioned, I won't count them now, but it was not the MMR vaccine. It really does not cause shedding that we're concerned about. It does not cause the disease to be propagated. So we need those who have been exposed to behave responsibly. And when we direct them to stay home, they should stay at home. We ask them to not have company. They should not have company. And I know holidays are coming for many of us in the county. And again, as hard as it is, they really need to make sure that they don't expose other people. Those exposed must stay home for 21 days after an exposure. For those who have the measles, they need to be away from people for 4 days after the rash is gone. So they are definitely infectious 4 days before and 4 days after the onset of the rash, so in that window especially. I have a list of schools that I have unexcluded because they've reached 95%. And actually the percentage, 44 schools out of the 61 that I have originally excluded have now been unexcluded. So they have achieved the 95% vaccination rate, and that's 44 schools have reached that, which is awesome. But I will remind them, as well as anyone else, that those students in schools who do not have their MMRs, removing those who have exemptions, the religious and the medical exemptions, of course, we honor. But for those who do not have the MMR vaccine, even though they have reached the 95%, I'm looking at you, and I'm following, and I'm auditing, and they'll hear more from me very soon about that. Every student in the school must receive the MMR unless they have an exemption, a medical or a religious one. So I'm going to name 3 schools for you in our community that have achieved the 95% vaccination rate and have no students who still need MMRs. That means they're all up to date. The first is Yeshiva Kinyan Torah di Satmar. We completed their audit on the 20th of December, and it was 100%. Bais Yaakov Elementary School of Rockland, the audit was completed on March 7th of this year. 99.3% of the children are vaccinated. And Talmud Torah Darkei Avos, their audit was completed on February 20th, 96.17%. It can be done. And we want to compliment them and the other schools. We want to congratulate all of them for what they have been able to accomplish. I would also like to take this opportunity, as Mr. Day did as well, to thank the state DOH for their tireless support of Rockland County's efforts to date. Their assistance and support have been and continue to be vital during this public health crisis. We are in touch with them continuously and do appreciate their guidance as well as their support. We've had an EIS physician, that means the Epidemic Intelligence Service physician, with us on and off from state DOH. That physician was at state DOH and has come down and gone to the homes, seen the patients, drew blood, took swabs from the nose and the throat and wherever else had to be, and educated patients. And that help has been invaluable. And tomorrow, actually, I'll be meeting with measles experts from the CDC, and we'll learn more, hopefully, from them at that time. So thank you all for your interest in this. But again, the most important message is prevention. And I guess the second message is stay the heck home if you're ill or you've been exposed. Thank you.
Okay, in closing, before we take questions, I just want to reiterate one thing. The Health Department's mission has been from day one, since this started, was to maximize immunizations and minimize exposures. That is still the goal. You heard some of the numbers already in the efforts that the Health Department has been part of to have schools comply. There is absolutely no reason why every school in Rockland County cannot achieve the same goal. There is no religious reason. There is no medical reason. There is absolutely no reason. I've heard a lot of excuses as to why this is happening. A lot of times fingers have been pointed at certain areas of this county. The fact remains, this is an achievable goal. And I think what has to happen here is people need to put whatever fear they have away. And if they look within their own community, they can see there really is no need for fear, because within our religious community in particular, the children are being immunized. The numbers are very clear. and defined. And I think we have to remember one thing. It's a very simple thought, and especially in the era we are now. It's not about you. It's not about me. It is about the greater good. It is about the fact that the needs of the many outweigh the desires of the one or the few. If we just put a little bit of that into the conversation, maybe we wouldn't be in this mess right now. So again, we're going to take all the steps we have to take to deal with this crisis. We will obviously respect the court's orders and directives, as we will, but it does not stop us from coming up with other strategies designed to work through this process and to make sure that people of Rockland County remain healthy. So with that, we'll take any questions.
I don't understand what the criteria that you're announcing is, how you will identify those people, and how you will keep them at home.
All right, again, we're not going to quarantine people. We've heard that many times. Quarantine, first of all, is useless because people are contagious for quite a period of time beforehand, before they even show the disease. Absent putting a cop in front of somebody's door, all right, there is going to be something of an honor system. What we're saying to people is this. You are being noticed by the Commissioner of Health that if you go out after you've been identified and you break the order, you are subject to fines. Those fines can be up to $2,000. So if a neighbor sees you go out and makes a phone call, and we find this to be true, that's what's going to happen. There is no absolute answer here. I mean, there are laws in this land. People know the speed limit is 55 miles an hour. They drive 80. It happens. So for those who are looking for an absolute in this life, let's understand something. It ain't going to happen. We're doing the best we can while respecting the civil liberties this country guarantees. So we're telling people, understand this. We are serious, like we did this 2 weeks ago. We are serious. When we said the emergency declaration comes with it a B misdemeanor charge of 3 months in jail and a fine. Not that we're going to lock anybody up, and I had the same questions. So we do what we can do within the limits of civil liberties. And again, the other strategies are not viable. We cannot quarantine people. It's just not a workable scenario. This is not Ebola. These are measles.
So people of what ages, and again, how do you identify them? How do you know?
I'll let Dr.
Ruppert.
Ruppert.
Shot and who doesn't? People of all ages, children.
This disease has affected mostly children in the county, so we are still developing the criteria. We'll update you as soon as we have anything more.
So you said you're appealing. Are you trying to reword the emergency order to try to make it legal? What are
No.
you?
We're not rewording the emergency declaration. There's a temporary restraining order on that right now. We can't do anything with that, but we are appealing it. We do not agree with the judge. I've said this before. The judge may believe it to be legally sufficient, but it is wrong-headed. For starters, the fact of the matter is he challenged the power of the executive law number 24 about declaring emergency declarations. That is abided by everyone in the state, including the governor of New York, and said something on the lines of you only have it for 5 days. 5 days references local laws in Rockland County. There is no connection between the two. So even this non-attorney can understand that. What we are doing here is pivoting based upon the limitations that we are temporarily operating under. Short version, we are not going to sit here and wait for a court decision to take steps. And we are taking the steps that we can take while we are awaiting the court to move forward.
Can you talk about the timeline of this? If you're appealing, is the clock still running on the 30 days that you issued back in March? And could you or would you issue a new state of emergency if it came to it?
Yes. County Attorney Tom Humbach.
How you doing? Thomas Humbach, Humbach. With respect to that 30 days, the law is not absolutely clear. There's not a lot of decisions from courts on that issue. In fact, there are probably none on that particular issue. We will play it by ear. The safest thing to do is, if the 30 days does in fact run while we're waiting for court intervention, is to renew it or declare a new state of emergency. So I think that would be how we would handle that.
Tom, while you're there, you had asked the judge for some kind of clarification of his order regarding the impact on the schools. Did you hear back from the judge?
We have heard back from the judge.
I mentioned it.
Yes, and the judge indicated that the children from Green Meadow Waldorf School can return to school.
What about peace through play?
That order was not specifically mentioned in the petition. by the students. As such, we are going to appeal the entire TRO. And my understanding is that the students are at all the Green Meadow Waldorf related schools.
And Peace Through Play is one of them.
Yes, if I recall correctly.
And just to follow up, Laura, I'm sorry, just to follow up, as it relates to what I may do in the future, I will do whatever I have to do to ensure the public health of Rockland County. And if it means issuing additional orders, I will do that if it's warranted. Laura?
Do you have a time frame as to when this language is going to be finished and when you'll begin to implement it?
ASAP.
Oh, right now, we're working on the information from the health department. As soon as we can get that put together, you got to realize we got this order Friday afternoon after work hours. We spent the weekend amongst ourselves coming up with potential strategies. We couldn't talk to anybody until Monday, which was yesterday. So
it could be days, could be weeks.
it's not going to be weeks. No, it will be at most days.
Okay.
Can I ask the health commissioner, I'm a little confused how you calculate vaccination rates for any given school. If a school has 100 students, 10 of them have gone through the process and have a religious exemption. The other 90 are vaccinated. Does that school have a 100% vaccination rate or a 90% vaccination rate?
90%.
Okay. So when you're calculating for purposes of the 97 or 95%, the kids with exclusions are in the larger number?
They're in the denominator.
Okay.
Correct.
I think I can provide another clarification for Tony on those numbers. It is illegal for a child to attend school in New York State without either a vaccine or an exemption. If there are children at schools with neither a vaccine nor an exemption, that's going to be something that we're looking at and something that the State Board of Education maybe or the Public Health should also look at. So that's an issue. That's why they're not calculated in, because they're not supposed to be there. So
Yeah, but Tony, by and large, exemptions are minuscule in any school. We see that in the public school system, they're minuscule. It begs the question, why do we have in some schools abysmal rates of vaccination rates? And the only answer here, again, even anecdotally looking at some of the reports that came back from our local media outlets, with parents who were coming in the aftermath of the declaration, they were saying straight out, well, I didn't want my child, upper elementary school kids, middle school kids, I didn't want my child, I wanted to wait till later to see if it was safe. That's not an exemption. That's neither medical nor religious. So it's a matter of ensuring that the laws of the state are followed in the school system to begin with. And again, 85% of our cases are children. And I'll remind everybody, measles is not a fever and a rash. Those days are gone. We found out later in life that measles can have serious, significant impacts upon your health as you get older. So we're treating it with the seriousness we have found it to be.
How many active cases are there right now? I know that Mr. Sussman keeps saying 4. I have not heard you state a number, and I don't see it on the website, so I don't know where he's getting it, but how many active cases now? Can you give a number?
I'm glad you asked the question. We don't discuss active cases for measles. We discuss active cases for diseases like tuberculosis. We do not discuss active cases for measles. So that should end that. We will not discuss active cases because there are no such thing.
In looking at the NIAC exposure, 42 people who were exposed, do you know if any of them in fact contracted the measles or not?
First of all, the incubation period, as I'll remind you again, is up to 21 days. So those who are not immune will be observed during that time and have been advised to remain home. I won't go into details about each particular individual, but there have been no cases to date. Thank you.
One thing I want to add to Robert, you just heard his statement, 21 days incubation. I think Mr. Sussman may have a crystal ball that we're not aware of, and so some of the anti-vaxxers, it is not an argument. We don't know who is infected. We do know if somebody walks into a hospital and exposes 42 people, we have 42 potential cases. We do know in the United States of America, in 3 months, we have more cases than the entire year of last year. So this focus on the only 3 or 4 cases that's being made by counsel and others in the anti-vax world is a distraction. There is no way we can know how many measles cases are out there for virtue of the fact that they carry the disease unknown for 4 days, and their exposure can be 21 days before the disease reveals itself. So again, to Commissioner Health's comment, I wholly endorse a statement This is not a matter for discussion. It's a distraction. And frankly, it's not really an issue at this point.
So the health commissioner in New York City didn't mince any words today, saying this outbreak is being fueled by a small group of anti-vaxxers in these neighborhoods. They've been spreading dangerous misinformation based on fake science. Do you agree with that
I
statement?
agree 100%. And I frankly, Mayor de Blasio and I certainly are on opposite ends of the spectrum, me being from former law enforcement. But I'm glad to see you followed Rockland County's lead and did something. I only wish we had the ability to do the same thing here. But right now, we are held up by the courts.
Any date, Tom, when you go back before Judge Thorson? Is there a conference or any timeline?
Yeah, on the Supreme Court level case, the court has asked us to put in our response to the initial petition by April 19. We'll be preparing those papers for filing on that.
That's not the one
day.
that just got.
That's the one. That's the one that we just got the decision on.
So
yes.
it's April 19.
Yes.
Papers are due.
Right. On the federal case, in case anybody's interested, we submitted a motion to dismiss on Friday. It's filed with the court. We haven't yet got any opposition.
And an appeal goes to the appellate division?
The appeal on the state case will be going to the appellate division, yes.
Just to clarify the orders that you're working on, Dr. Ruppert, that will apply to whether you're exposed or you have the measles. That will apply to anyone, not just under 18, that you have to stay home?
As I said, we're still developing that,
Okay.
so thank you. Thank you. If I can just, Tony, if you don't mind, if I can just add to the comment by Dr. Barbeau, I'm totally in agreement with what she said today. She's a pediatrician, I'm a family doctor, and what is going on with the misinformation, as I called the other day, junk science, from the anti-vaxxers and those groups is unacceptable. It is not something that people should hang their hat on. We have evidence-based information. This is scientific, this is tried and true, the measles vaccine is safe, and they're saying many other things that are untrue. So what I'd like people to do is to really pay attention, not to just what's out there that is untrue, that's junk, but to the facts. Again, MMR vaccine is safe, and we can prevent further cases, and again, we need to have the cases reported to us. There are many cases in the community that have not been reported. That's another reason that a lot of things have been continued, this outbreak continues. Because every person who's infected is a potential to give it to, the measles to 18 other people, so you do the math.
And also, I just want to add on, we made this point when we were here 2 weeks ago for the emergency declaration. The holidays are coming up. I don't know how many ways we can say it, but you having the ability to transmit measles to family members and friends is just not something you should be even involved in. So we're asking people, please, think about your families, think about your loved ones, think about the infant baby in that household that you're visiting during a holiday. Think about what can happen to that child. Think about a pregnant woman and the complications that can happen. Think about, I'm a cancer survivor. Think about a cancer survivor who's just trying to get through life, and and he or she dodged a bullet and now is able to move on. Think about those people. So really, it's at a point now where, yes, we have to enforce in any way possible as necessary, but basically we're also saying this. Please recognize the danger you're putting other people in. This is not your mom and dad's or grandma and grandpa's measles. This is serious stuff. And we're asking them to be respectful and mindful of those around them and to simply get healthy again. It's just, I can't make it any more clear than that.
So the total number, Ken, is 168.
168.
Right? Since October.
Since, yes, since the beginning of the outbreak, correct.
That we know of.
That we had that again, Dr. Ruppert made a reference to not having measles cases reported. We can say with a pretty good degree of certainty that we're well aware of the fact that that is going on. That people are not coming in, they're staying home, they're not seeking help, they're not reporting to the doctors who would report to us. So we have every belief the numbers are much higher than that, which should be a scary thought to everybody.
Tom, just to clarify, is it fair, so the petitioner is represented by Sussman and Finn.
Yes.
Are not members of the ultra-Orthodox community, is that correct?
Not to my knowledge.
Okay.
The Green Meadow School, that's not a place that you would make such an assumption.
Okay. And what about Finn's, because we know very little about who she represents, right?
Yes, I don't know who that person is. I don't know where they go to school. But apparently it's one person. Mr. Sussman represents approximately 24 people.
Thank you, thank you.
Thank you.
Thank you. Thank you very much for being here. What was he waving at you for? And I know Tony's gonna ask me a numbers question.
If anybody wants
I
copies
tried
of
to get my
that
math right.
motion to dismiss, just ask.
Commissioner, again, I'm at a loss of what to say exactly.
Doesn't keep you going.
Please just
Nice to have a
some
challenge.
clarity on what to tell the readers, what your, you know, the things you're trying to press.